Gender dysphoria is defined as a descriptive term that refers to an individual's affective/cognitive discontent with the assigned gender, but is not specifically defined when used as a diagnostic category. DSM-5 criteria as defined by the American Psychiatric Association. I will be breaking down the criteria into two categories. One category addressing the criteria needing to be met regarding children. The second criteria addressing the criteria needing to be met in adolescents and adults. The gender dysphoria criteria in children. Criteria A. A marked incongruence between one's experienced/expressed gender and assigned gender of at least 6 months duration as manifested by at least 6 of the following. 1, which must be criteria A1. A1 is a strong desire to be one of the other gender or an insistence that one is the other gender. 2, in boys assigned gender, a strong preference for cross-dressing or simulating female attire. Or in girls assigned gender, a strong preference for wearing only typical masculine clothing and a strong resistance to wearing of typical feminine clothing. 3, a strong preference for cross-gender roles in make-believe, play, or fantasy. 4, a strong preference for the toys, games, or activities stereotypically used or engaged in by the other gender. 5, a strong preference for playmates of the other gender. 6, in boys assigned gender, a strong rejection of typically masculine toys, game, and a strong avoidance of rough and tumble play. In girls assigned gender, a strong rejection of typically feminine toys, games, and activities. 7, a strong dislike of one's sexual anatomy. 8 is a strong desire for the primary and/or secondary sex characteristics that matches one's experienced gender. Criteria B, the condition is associated with clinically significant distress or impairment in social, school, or other important areas of functioning. Gender dysphoria in adolescents and adults criteria. Criteria A, a marked incongruence between one's experienced/expressed gender and assigned gender of at least 6 months duration, as manifested by at least 2 of the following. 1, a marked incongruence between one's experienced/expressed gender and primary and/or secondary sex characteristics, or in young adults, the anticipated secondary sex characteristics. 2, a strong desire to be rid of one's primary and/or secondary sex characteristics because of a marked incongruence with one's experienced/expressed gender, or in young adolescents, a desire to prevent the development of the anticipated second characteristics. 3, a strong desire for the primary and/or secondary sex characteristics of the other gender. 4, a strong desire to be one of the other gender or some alternative gender different from the one's assigned gender. 5, a strong desire to be treated as the other gender or some alternative gender different from the one's assigned gender. 6, a strong conviction that one has the typical feelings and reactions of the other gender, or some alternative gender different from the one's assigned gender. Criteria B, the condition is associated with clinically significant distress or impairment in social, occupational, or other important areas of function. This comes with specifications. We must specify with the disorder of sexual development. We must also specify post-transition, which is the individual has transitioned to full-time living in the desired gender.